Pacific leaders and medical practitioners say they're saddened and surprised after a shock resignation by a prominent health leader in New Zealand. Sir Colin Tukuitonga's decision to resign from his government advisory roles, including as chair of Te Whatu Ora's Pacific Senate, has had a ripple effect across the New Zealand health sector and especially within Pacific communities. He told RNZ Pacific the reason for stepping down was because he had no confidence in the New Zealand government. Alicia Foon reports.
A shock resignation during the second week under the new coalition government. One of New Zealand's leading voices in health, Sir Colin Tukuitonga, revealing the real reasons for stepping down from almost every advisory role, including as chair of Te Whatu Ora's Pacific Senate.
I have no confidence in they're not going to treat Pacific people well. I'm pretty confident about that, and I want to be free to speak up and speak out.
Sir Colin is a Niuean-born New Zealand doctor, public health academic, public policy expert and advocate for reducing health inequities for Māori and Pasifika people.
The fact is, I was appalled at the decision to repeal the smoke-free legislation because it's Māori and Pacific people who are going to pay the price. That really annoyed me no end. I thought it was immoral. The government needs to do better for and with Māori. They have some of the worst health outcomes in the country, same as our people.
There have since been tributes and support backing his decision by Pacific leaders like former Minister of Pacific Peoples, Alpito William-Seo.
Surprised by Colin's resignation, but fully understand it. And it's better that he's outside, not chairing the Pacific Senate, because as a professional and as a clinician, you want that voice to be able to critique publicly the government's new direction in terms of health.
Meanwhile, in a statement, Health Minister Dr. Shane Reti, who also happens to be the Minister for Pacific Peoples, praised Sir Colin Tukuitonga for his contribution to health and wished him well for the future. While Sir Colin leaves the public sector amid the changing political landscape, Christchurch-based Pacific community advocate Melissa Lama says it's motivated her to re-enter this space and advocate for Pasifika.
I was sad and gutted as a young person, as a Pacific woman, as a brown person going into the public sector right now in this political spectrum. I really want to come in with skills and contribute in a different way towards the positive outcomes that even Sir Colin and myself and everyone else in the community want to achieve.
She says it's unfair that Sir Colin had to choose between being a critic and voice for his community with giving up his position of influence.
We shouldn't be setting the precedent that someone like Dr. Sir Colin has to leave his space in order to represent and speak authentically about what is needed for our people. There's got to be a better way in which we as public servants can still have a voice for our community and be who we are, because when you're talking about Pacific, they're essentially talking about me. I still live in overcrowded houses. I've grown up in overcrowded houses. People in my family are still trying to buy their first homes. They make low minimum wage income. Some are on the sickness benefit. So everything that is happening that I'm contributing to is also affecting my family. And I think that's where I'm getting, as you can tell in my voice, I get really, really emotional.
Member of the National Pacific Health Senate, Dr. Kiki Moate, says he doesn't plan to step down and wasn't aware of any other members choosing to resign either.
I'd resign probably not because of the government. I'd resign probably because there's too much work to do and getting tugged around the place. Of course, we will work with the government for the next 3 years if they stand for 3 years, because that's the process. And then the outcomes of what we work with, that's the opportunity then to say whether it's working or not, or to reflect and push back and debate. And I don't see the debate happening from outside in. The debate's got to be inside and around the table.
Unlike Sir Colin's approach, which is now to speak up and speak out from the outside in. Despite the varied perspectives, everyone involved is united about holding the coalition government to account in their own way.